much. Very good having you.
Thank you, Neil. Thank you very much.
All right, now to another Washington controversy. The census reporting today that the number of uninsured in this country is now at 46.3 million people, but about 10 million of those folks are here illegally. That worries Republican Congressman Michael Burgess. He fears including illegals in our official population all but officially makes them Americans, which means they are officially eligible for universal health care or something very close to what the president's going for anyway. Congressman, good to have you.
Hey, Neil, good to be with you.
If they're in the census, they're essentially constitutionally, as our Judge Napolitano put it, eligible for whatever the president proposes, right?
Well, one of the things that has troubled me as we've gone through the hearings on this health care reform that has worked its way through committee is we've never really addressed this issue. We leave it out there as some sort of unspoken thing that will be handled at some point in the future. But as we all know, if you don't fix that problem in a state like mine in Texas, you haven't fixed anything at all. So we really do need to decide what we are going to do about this problem. And then last night you saw it bubble up and boil over into the parliamentary debate that you just had.
Well, Congressman Joe Wilson, when the president had claimed that illegals wouldn't be getting this coverage, I'm paraphrasing here, he shut up and said, "You're a liar." So is the president just unaware of this, or do you think he knows in his heart of hearts that when we do get health care reform and he wants to cover everybody, if not almost everybody, that a lot of those everybody's are going to be illegals?
Well, right now, of course, we have a provider mandate in this country, and every doctor is well aware of this, that if a patient comes into their emergency room needing treatment, surgery, or imminent delivery, that they'd better get up and take care of them because they've got 30 minutes to do so, or the federal government's coming in with a rather large fine. Now, that's not a good way to distribute health care, so we've got a lot of people concerned about the overuse of emergency rooms. But still, the care is there, and everyone who recognizes that utilizes the emergency room as their point of first access. We can and should do better. The question last night came up because the president said there's nothing in the bill. It was really unclear as to what bill he was talking about. I thought he was talking about our House bill. He said there's nothing in the bill that would provide for care for people who are in the country illegally. Well, not true. Number one, there are the EMTALA laws that already exist that say you've got to take care of them if they show up in your emergency room. But more to the point, in the bill that we had before our committee, we were rebuffed, we were turned back when we attempted to have an amendment that said we are going to ask people to verify their identities when they come in and sign up for benefits. Not when they come into the emergency room sick or hurt, but when they come into the office to sign up for benefits, we're going to ask that they do something more than just take their word for it, that they're a citizen, so-called self-attestation. And that's really where the breakdown has occurred. We were defeated in committee on a party line vote, both in our committee and on the Energy and Commerce Committee and the Committee on Ways and Means, where we tried to rectify that situation. So the president was being perhaps accurate but disingenuous when he said that there's nothing in the bill that says we have to cover people who are in the country illegally. Maybe not, but we're also not allowed to ask them if they're in the country illegally, so how would we ever know?
So you were thinking, so Congressman, you were thinking he might be lying, but you just didn't shout it.
I perhaps might have pointed out that there was a propensity for prevarication on the part of the POTUS, but I didn't do so.
Very well put, Congressman. Thank you very, very much. That's a good way of saying the exact same thing. See, it's all in the language. Meanwhile, Republicans are feeling pretty cocky these days. A one-word